who has grandchildren, who has children, you need this information to be out. And a lot of what she does, she works with teens. So Miss Mattie Mason is an RN, a BSN community leader. She's a community liaison. She is just all over the place. She's a wife. She's ministering. She's also an author of 2 books. And I am just telling you, her hands are full. Desire that she has, and the love and the devotion that she has for the community, for teens, for our community as a whole it's so touching, because she is actually devoted to this. So I want her to introduce herself, and I'm telling you, you're going to be on fire after you hear her.
Oh, thank you so much, Miss Rhonda. I'm so grateful to be able to be here this morning. And I want to thank and grateful for the people who are listening.
Yes.
And most of all, I have to give thanks to God.
Yes.
Who gives us our assignment, and Jesus, who's given us the ability to continue doing what
You're
God has
the
called
right
to do.
accolades.
So thank you so much. Yes, and so Miss Rhonda, I know the flyer said that I was a author. I'm a mother. All of those are so great. But the thing that I'm most impressive about is being a registered nurse.
Yes.
You know, God give us all, when we are all born with a purpose. And so I teach the young ladies that all the time, or the students, that all of us have a purpose to make the world better.
Yes.
And my purpose God gave me when I was in high school was to become a registered nurse.
Oh, wow.
Yeah. And so I graduated from high school, went to Prairie View in 1974.
I love it.
And I tell the students all the time, you don't want to become a professional student.
We do have those people that go to school forever and a day and never graduate.
Well, I had the opportunity to change from my degree in nursing, but I told the professor, no, I want to be a nurse.
Yes.
And I became a nurse, graduated in 78, and I thank God for that.
Yes.
And so now all of the things that I do really center around me being a registered nurse.
I love that.
Yes.
I love that.
And my purpose is to help people, and my helping people, it comes with being a registered nurse.
Yes.
And so in 1990, God blessed me to start his business, New Life Perinatal Healthcare Services.
Yes.
And New Life Perinatal Healthcare Services is a home health agency.
Okay.
And when it said, like it says, perinatal, from the time you're pregnant until 1 month is what perinatal. So that was always the vision from 1990, was to take care of mothers and babies. When I was young, I always loved mothers and babies.
Oh my goodness. And I can go back to when I was, in the hospital and having a baby, and I knew nothing, absolutely nothing. And I was given this little bundle and sent home, and with some Pampers, I think, and a bottle. And it was like, okay, have at it, do it, do it. What do you do? Right. So, I'm really, really interested in, we were talking earlier before everything started about everyone needing a nurse. And I think that is so important, that we need those medical professionals, especially nurses. So what's your take on that?
Okay, so as I go now, one of my roles as an advocate is to be, to go to the legislators, to go and speak up for mothers, babies, and infants. And one of the things that I tell the legislators when I speak is, in the hospital, who take care of you?
Yes.
The nurse. And so we are sending patients, especially mothers and babies.
Yes.
We're sending them home early.
Yes.
Which I'm a very avid, I'm for going home early.
Yes.
But you need to make sure the nurse is involved with that dish. A clear example, I just had I go into the schools, because you've gone into the schools with me.
I loved it.
To speakers. And one of my students, we just by the grace of God, we did a class so she could know what to do with the delivery and all. Well, she was 35 weeks. She ended up that day going into labor. She delivered a 35-week baby, 4 pounds, but they send that baby home in 3 days with this teen mama weighing 16.
Goodness.
She's 16, and the baby's 4 pounds.
Wow.
Right. And so again, I'm for, and the baby met the milestones,
Yes.
but you still need to have the nurse
Yes.
to go out and continue. Whereas now they have the mothers coming right back
Yes.
and getting checked and all. So if you sent the nurse, you wouldn't have to be putting that extra strain on the family with a new bundle, as you say.
So what do we do as a part of the community to get this pushed? Because it is something. I mean, you're sending a premature baby home, and like you said, yes, they're meeting the milestones, but what about the mentality, the psychological? Where's that mother? 16. What do you do in emergencies? They're not. So what do we have to do? What would help to get this pushed further than where it is now?
Okay. So one of the major things is awareness.
Okay.
So we have an infant mortality awareness initiative.
Yes.
It's an infant mortality awareness initiative. The beginning of everything is education. Making the community aware.
Definitely.
When these moms are pregnant, first of all,
yes,
there are services out there.
Yes.
Now, are we helping them access the services?
Okay.
You have Harris County Hospital District, Harris Health.
Yes.
That those patients can go and get prenatal care.
Yes.
You need a nurse to help you navigate and make sure you could get the service, the appointment,
yes,
from the community, because myself as a nurse, I can call at Harris Health and get an appointment.
Okay.
So no client should be in the community
yes,
without prenatal care.
That's
so it starts right there. But somebody have to be aware of that.
Yes.
And the community. So I tell everybody, mentoring is the biggie.
Yes.
Somebody there, you're going to take the time and talk to them. So I spoke to one neonatologist, and she said, well, they have strong parent support, but we all know raising children, it takes the village.
Yes.
And so that's where we're going to have to be. Become aware of what's going on, and then become a part of what we need to do to help these mothers and babies.
That's, and you've said that, and it's so important because we hear things all the time. It takes a village, but it actually really does.
That's right.
Because you may have a piece of the puzzle that I don't know about. And you're right. It all starts with the education. I was talking to someone, and they just had a new baby. And I was like, well, and they said, well, the baby has a little cough or whatever. I said, well, make sure that you're putting the baby on the back. Oh, no, I just put the baby and I just pat him and I just put him down. And I was like, no, you have to put the baby on the back, and when people don't know, because I'm still a little young, but, those times, you put the baby in the bed,
right?
You put him and you pat him on the back, and and let them sleep. But now you can't do that, and I think it's also going to be a lot of us getting out of the old school mentality to be able to help the young moms. So that's where the education is really going to come, because you got that pivot right in there, so if you have them saying, oh no, just do them, the doctors don't know what they're talking about, but actually they do. And working in the field that you're in, I'm quite sure that you see that all the time, especially with tips, working with the mothers and everything, which I think is a very I love that program that you have. I love that because as I shared with you, I said I was a teen mom and I was, in school at the time, and there was no program like the one that you had that, was there to help. And I'm really so appreciative that, the Lord placed that desire, in you, that gift to be able, and I've seen you with these children. And also, I hope we have time to talk about the not only the programs that she has, but also on how to, be a blessing to what they're doing. They give out scholarships, all types of things. I have gone to their luncheons and galas, and it has really, really, really been so beautiful to see them walk up and be able to, this big gleaming smile. Someone's holding their baby, but they finished.
Right.
They finished the course. So,
Right.
if it's, we have to start at the beginning.
That's right.
With hitting the mortality rate. Why do you think it's so high in the Black community?
Well, I still feel our community is not like we used to be.
Yes.
The community, our community started with, family first. So you had grandmas, aunties, uncles who were there.
Yes.
And then you had the church.
Yes.
And you had a community. And so I think what we have to do is get back to that. Yes. And, teaching those values that our parents taught us. Yes. Because a lot of what I do is because of the values I saw my parents doing.
Yes.
Taking care of the community.
Yes.
Taking care. So I still say a lot of ours is that lack of education. Now, food wise, when I go to the home, a lot of those young ladies, they not cooking them beans and rice and cornbread like we raised up on.
No, they're not doing that.
Well, we may not do it either.
Well, not all the time, but it's not Roman noodles.
I know. But it's still one of those things that we need to become mentors to them.
Yes.
And help them.
Yes.
And the thing is with the Teenage Incentive Program, TIP came about when I first started New Life in 1990. God gave me the vision to work with the pregnant and parenting teens. And so I started going in just as a program, like it says, incentive to motivate them.
Yes.
And so from that, it has evolved into a dropout prevention. Wow. Not just for the at-risk teens, but any child work with that have challenges in school to drop out.
Oh, I love that.
Yeah, and it really has. And right now we're doing a major intervention in Acres Home.
Okay.
So the thing that had been doing with the TIP, we did it for 25 years in Katy.
Wow.
Yeah, I have some babies that are literally 31 years old. Yeah, and it's a poem. Maybe one time I'll get to share the young lady who wrote the poem about how TIP impacted her. Yes. And our motto is, you can. It's not how smart you are, but it's how determined. It's your determination that makes you succeed. And that's what we try to instill in the young people. We all have challenges.
Yes.
And so, as a mentor and as a person who's there to help, then you can help that come across. But with the registered nurse being involved, she's the one who go into the home and she does an assessment. She does an assessment on the medical, social, educational track. And so then she developed a comprehensive plan for the family. Oh. And that's the missing link that we're in here in Houston that we don't have. We have a lot of programs, but nobody to bring them together. Now, it's, again, I don't know if I answered your question for the Black community.
Yes, you have answered that, because I look at with ACAT, the Acres Home, and you had actually brought all of these leaders together, nonprofits, for-profit churches, and all, just to focus on this dynamic in the community, which has, by the way, been phenomenal. I hate that I've been missing a lot of it, but I really want to get active back into it again, because they're really doing phenomenal things. And with this, as you being a nurse, I think they've got the right person spearheading and pushing for this, because you are determined. And, wherever the community can help, we need to help.
That's right.
Because it's our children, it's
That's
our
right.
babies, our legacy, that that's falling through the cracks.
Exactly.
And so how would they say I'm a mom, I'm at Harris County, how do I don't know what to do. So how do I implement that, getting a nurse to come in and to give the family a plan, or is this something that's a future thing, or what do I ask for when I'm in the hospital? Because you're so overwhelmed, in your head, and trying to make sure that you know what you're doing, because everybody's there and googly eyed over the baby.
Mm-hmm.
But then you have to come to the realization you're taking another person home, and
Mm-hmm.
you really don't know what you're doing.
Mm-hmm.
And some people may not ask.
Right.
So is there something that can that's in the hospital where they can assess and say, hey, look, this person may need this or that, because I know they have it when if someone's gone through an amputation or whatever, they have these different programs. So what does that young teen mother or that grandmother who's got to take the baby and mom home, and the mom may not be, but can the grandmother, the mother, who how do we do that?
Well, first of all, in when you're dealing with mothers and babies, that's even with a teen or older woman, older mom. The ideal, the perfect is early.
Yes.
Early prenatal, early intervention. So what we want to do is make sure the family know that these services are available early. Get them involved. Harris Health has a program, Healthy Start. The city has programs, Healthy Start. These are programs out there, but I don't know if people know about it. And then with the teenage incentive, we're out there. You have the managed care programs.
Yes.
They're out there. So there's a lot of services, that's what we want to start early. Okay, but if they are in the hospital, then you want to ask for. And my thing, and what we focus on is medical, because the women are dying because of medical problems. They're not dying because they don't have food in the house.
Yes.
That makes a difference.
Yes.
But we want to make sure their medical needs are taken care of.
Right.
So when they're in the hospital, you ask for some medical care follow-up.
Okay.
And then the thing with the mom, if the grandma and the mom doesn't feel comfortable taking their baby home, just say, I need some help.
Wow.
And you ask for help.
That's it.
The managed cares, like your insurance.
Yes.
If you, like you said, if you had an amputee or whatever, you would call your insurance and say, what services are available?
All right.
And so those are the type things we want to get them educated early.
Right.
And intervene early. So that they don't wait till the end.
Yeah.
But, and then New Life and Teenage Incentive, we're on the website. We're there. You could call us, and that's one of the things I do. I assess the situation and refer you to the resources.
Okay. Can you give them your contact information so that people can have that?
Yes. New Life Teenage Incentive number is 832-903-1272. That's Teenage Incentive. And New Life is 281-578-1205. But you could just call TIP via teen for those services. And Teenage Incentive website. You could go on the website. We are there.
Okay.
And then we will direct them to wherever they need to go.
Okay.
Even if you're not, even for any high risk mom.
Okay.
Because we want the high medical problems. You got blood pressure, you got diabetes, or you can't get your medicine, and all teenagers are considered high risk.
Well,
and so, and you want to make sure. And the other big thing that we do is making sure they stay in school, they enroll in these PRS programs, pregnancy programs, because I tell everybody our tax dollars pay for these services. So we want to make sure that we're
getting them.
That's
getting them and using them,
and
utilizing them. I think that is a big problem, is that no one asks. No one knows, and no one asks.
Right.
For those different programs, because it seems like there's a lot. It was City of Houston, Harris County. There are a lot of programs that we don't even tap into because we don't know.
We don't know.
But the crazy thing is we never ask either.
That's right.
So that's on our end, but in saying that we need to educate, the people that are out there, and not just, pushing. People don't want to read, so we have to make sure that it's simple and something that
Right.
they can grasp onto. So tell me about how you started everything with the infant mortality rate. What are the numbers? Because I know for you to be, the way you are about it, there's some high numbers in there. Because Miss Mattie, she just doesn't. She goes when she gets in there and she's determined, y'all. She is determined. So
Yeah. Well, what I knew, we all hear about the mothers.
yes,
And in fact, I'll just know next month is Black Maternal Week.
okay,
We all, and so we always hear about the mothers. And I'm a neonatal nurse. I worked at the previous Jefferson Davis Hospital.
Okay,
so I have a heart for babies.
and
I remember the services we provided at Harris Health in the 70s and 80s.
Yeah,
I mean, we did quality care, and our patients was successful.
Mm-hmm.
And even back then, they had the teen clinics.
Yes,
all of those was at the hospital, Jefferson Davis. Okay, but then when I have the speakers come into the school.
Yes.
And one of the speakers came in and she told the girls 78% of the babies in your area are dying.
Wow.
I said, what?
78%?
That's a lot of babies.
Yes, and that's a lot of babies.
I mean, she came in and she was talking about sleep study and safe sleep. Yes. And it's like, but wait a minute. That's a lot.
Like just spitting off numbers, but that's a lot.
And she showed it to my girls. And so if I was a mom, I would be very alarming. Yes. And that was between 2 to 3 months. And but she went through all of the things for safe sleep. So then I called some of the leaders and they would say, that seemed like a high number. So then I had her, that's the meeting you attended. Can you come back and talk to the leaders in the Acres Home community so we can hear what you presented to the students? So the presenter came back and they said, well, 78% of babies in Harris County.
Okay.
Which is still a lot.
Yeah.
But then it was broken down. Then the presenter gave us other numbers. I don't know if you remember.
Yeah.
It was like 3% Hispanic, 14%
numbers.
14% was white, and then Hispanics was 31%. But African Americans was 50%.
I know it was a low number for the others and high for us.
Yeah, so that's still a problem. Yeah,
that's over half.
Oh, So when I heard that, still that was like, okay. So I went to Representative Charlene Johnson in this area because it was showing the North and Acres Home areas are some of the higher areas, and so she and I came together and we created. That's how the Infant Mortality Initiative came about.
Okay.
And the goal of the initiative is first is education.
Yes.
We want to educate the people.
Yes.
And then bring awareness. Is number one. Bring awareness.
Yes.
Because I was on the Perinatal Advisory Council. That's for the whole state of Texas. And that's where the doctors get together and come up with standards of care for mothers and babies. And one of the recommendations from the committee was the Black community need to be educated on the infant mortality for the mothers and babies. And so I said, okay, then that's what I'm here to do now is to bring awareness that we have a problem, and so that was number one. We want to bring awareness, educate the community about the problem. And then we want to promote health equity. Now, we want to make sure these women are accessing care. I have a young lady right now. She's having, problems with her. She has insurance, but the deductibles are so high. And she has to pay $300 to go to her visit, right now until she gets the Medicaid and all of that straight. But you shouldn't have to do that. You shouldn't have to just sit out, because that's what Harris Health is there for. So it's awareness that you can still get healthcare is while you're trying to figure out the Medicaid or your insurance situation. Because the earlier the intervention, the better the outcome. Yes. The other thing, we want to be supportive. Support these families. Yes. I tell everybody, when you see a pregnant girl, ask her how you doing. Yeah. Ask her if she has any needs. Just reach out to them, be a support to them.
Now, is that just in the schools, or are you just saying
anywhere? If you at church, if you in the grocery store, you see a young lady, talk to her. Yes. My thing, especially in churches, we have.
I know you always say. Because we need to get back. When the churches before, everyone would just embrace like a family. It was like a family unit. Now, you did have some that would like push you back if you got pregnant or whatever, but for the most part, it was the values that were being taught. And with the family, it was like, we're coming together. Hey, this baby's coming. So let's get together, get our resources together. Okay, Mom, you're not in this alone. You didn't feel like you were in it alone. Now it's, a whole lot different because everyone's in their own little sphere of, pocket. But I understand what you're saying. All of the information, we have to make sure that information and encourage I'm really, with you talking about it, makes you want to go out and find somebody. Hey, you okay? Because the passion, I hear your passion in it, and you don't think about those things, but we don't know what's going through that young person's mind, or so we need to be there to help them. I love that.
The other thing too, I went and spoke to a group in here in Acres Home, because that's where my assignment now is in Acres Home. But I get patients from all over the city of Houston, Baytown, everywhere. But my presentation was when Mary, who was a teenager, was got pregnant by God. A vision, it was by God. The first person God sent her to, it wasn't to her parents, but he sent her to who? Elizabeth. A woman.
Yes.
A woman.
Yes.
And this woman, she was pregnant.
Yes, she was.
She was older. She was in her last trimester. Yes. And then her husband had been disciplined for his mouth. But she took the time and she mentored Mary. Yes. She taught Mary. She had to teach her the word or whatever. Yes. But she got Mary built up until the point she was able to fulfill God's purpose for her and the baby. Yes. And that's who we are.
Yes.
Yes. So we married the Elizabeths, and that's what I left them at, is where's the Elizabeths?
Wow. Wow, where are they?
Elizabeth. And we need the Timothys, because we have young fathers now who are now raising babies. Yes. And so we need to be there to encourage these young fathers, to be able to encourage them, help them to become men.
And I love that, because so many times we are so focused on the young girl, the young woman, the mother, and that you do have men who want to be fathers. There are Black men out there who desire and they want to be a part. I have to say that loud, because so many times our young Black men get hit with this, oh, you're just going to run off. No, there are some that stay. Some that want to be a part of their child's life. Just yesterday, we met someone who was like that. They had 10 children, but he was there. And that, to me, that meant a lot, for you guys to go one. I'll be shaking my head, but 10, but he was staying there, and he wasn't saying it grudgingly. He was happy about it. And there are other, young Black men. So yes, they do need to be encouraged. I love that. Do you offer mentoring for those young men?
Yes.
Okay.
Yeah. Right. In fact, I have a couple now, and so the young man, he stepped up, him and his mom. Wow. And so I've already got his mentor. Yeah. And then I have a mentor for the young lady, and they young. But so the men are coming forward. Wow, in fact, yesterday when we have a STARS program, that's where these are the any student that has challenges in school. not just you pregnant, but it was some pregnant young ladies there.
Yes.
We have them and the boys, and so the speaker was a young man, came, he spoke, and it was, how God just
Oh,
orchestrated. It was so good. But
wow.
he spoke to the young ladies
Uh-huh.
about, and he told them he had his first baby at 13.
Wow. 13.
Yeah, but then he went through everything. He done been through all kinds of, the jail, the prison, the whole
Yes.
thing. But he went back and found out the root of the problem. He's working on it. But he was able to talk to these young ladies
Yes.
as a father.
Yes.
This is what you should be expecting from a man. Yeah, it was really good. It was really good
Wow,
for
that
him.
sounds like it was.
It was awesome. But the young men, we bring speakers in that work with the men, the young men too. So we do have the men who are part of the programs, and they want to be. And that was even in Katy when we did it in Katy. Some of those young men come. They come to the groups.
Yes.
Yeah, you have the fathers coming.
Wow. So do you have any events that are coming up that you would like to tell the listeners about? Because the things that you put together, they're well put together. I love that. But they're focused and they are very needed. And I love that you get a lot of support. So, and there may be someone out there saying, hey, how do I support? How do I volunteer? How do I, become a part of, what you're doing? Because this may resonate with someone. We don't know, someone may have lost a child. And I've never experienced that. Thank you, Lord. Don't want to, but I pray for those who have, but, knowing and having, information.
Well, it's a couple of things three things we're doing. First of all, the Infant Mortality Awareness Initiative. We want to go to the different churches. We'll go and do a presentation.
Okay.
Church, community. I just met with some of the fraternities and sorority, just to do those presentations. You could call or email me at the Teenage Incentive. That's number one. Then the number two thing is we're going to do a resource fair at Acres Home. And this is to, again, bring the public entities so that people will hear from them and know how to access the public services. You have a lot of private, but then, our primary is our public service programs with the Harris County Public Health Department, the City Health Department, Harris Health. So we want them to speak, but we will have vendors so that people can become aware.
Okay.
That's the awareness.
I love that.
And then Teenage Incentive Program, we're having our end of the year gala.
Okay.
Yeah.
Okay.
Yeah. This year, we usually have it in May, but due to graduations, we're going to be doing the save the date. It's June. It's going to be June 6th.
Okay.
And it's the journey. We're talking about the journey. I've spoken to. I have two speakers in mind, but their journey to where they are and all of the teens, they had a journey. And so we're asking people to come and support us so that we can continue to help the young people on their journey.
Yes.
And so that'll be June the 6th. So the other way you could help, you could call. We need volunteers when we go into schools. Mentors, we need those.
Definitely.
And then if you can't do either, you could donate.
Yes.
It doesn't take a lot. You may want to put us on your donation for $25, $50 a month. But and we go to McDonald's and spend that much.
Spend over that.
And so you're reaching a young person, because whenever I go into the schools, I bring a speaker, and I always bring some kind of snack.
Yes.
So I say, "Are y'all want to see me, or you want to see you want them snacks?" So
it's a combination. Yes, it's a combination.
So we need the support, and most of all, those Elizabeth, we need your prayers. Prayer, because as we go forward, them enemies come at you.
Oh,
yeah.
Yes,
So
most definitely.
yeah,
most
we need
definitely. Whenever you're doing things and it's in the name of the Lord, you're always going to have those that are going to want to come up against you. When you were talking about, you were asking them, do you want to see me or you want to see the snacks? It's really you that they want to see. And I'm going to tell you because I witnessed it firsthand. When she walks in, they're excited. They you can see on their face acceptance. No judgment. I love that. When they walked in and they were like looking at me like, okay, now who is this? But when you walked in, you just had that. It was just your presence in walking in. You could see the comfort that came over them, and they were very attentive. While I was talking with them, very respectful, very attentive. You were giving out information, and I was in awe of how they were taking the information and just eating it up. And no one was talking or chit chatting. They were just eyes laser focused on what you were saying, what I was saying as a speaker there. So great job.
Thank you so
Great
much.
job.
And
Great
thank you
job.
for being an awesome speaker. Because you come, God put on my heart usually people to ask, and you had a great message. You really did.
Well,
and you are the example that they need to see. One day they'll be sitting where you are.
Yeah.
Loudy. Yeah. I'll never forget when we were doing this in Katy. One of the students told the teacher, I want to be where I want to do what you're doing.
Wow.
And guess what? She's doing it. When the teacher retired, that student became the teacher.
Oh my goodness.
Of that class. She
spoke it.
That's right.
She spoke. So I love that. I think when God is in the center of anything,
that's right,
that he's going to be the one to ensure that we have what we need to be able, because he's going to provide. He's going to give the provision for whatever the vision is that he has given.
That's right.
And this is a God-given vision, because I hear your heart.
Thank you.
When you talk, no matter what the program is. Some of the programs I didn't even know about, like the young men being mentored, which I think is awesome and wonderful. So what's coming up? What else is, what other visions are you, those that you can share? Because I know sometimes you can't share everything, Well,
the major thing now, like I feel that God is calling me to be an advocate. Nobody speak up what I hear, or maybe nobody, it can't say nobody, but I want to be a voice. I want to be the voice. And so God, I have now started going to Austin. And speaking with the legislators. And last year, Senator Cook and I, she did a bill. And again, where I said the nurse, the registered nurse is the missing link in healthcare in the community. So my goal is to try to that link come back, the public health nurse, but then to write some policies to show that our model. So I did a research paper, and the research is improving access to prenatal care, and it's by a nurse-driven program. And so we have a model now. I have a model, even a model for the children at risk. We have a model. So we want to write policies that's going to help improve the health outcome for our mothers and babies. Is where the thing now is. It's being an advocate in legislature, because I just found out my one of my consultants, who is the president, she was the dean at Prairie View, Dean Adams, when I was talking to her and letting them know that I was going to make a voice, and she was the one to say, this is a legislative problem. You need to address this on the legislative level. So my husband and I, for 20 years, we would drive to Austin.
Oh, wow.
But we was talking to the health department.
Yes.
I didn't realize I should have been talking to the legislators.
And they're just letting you talk.
I know. They just So a bill that was passed that made a big impact, House Bill 1575, which made a great impact on health care for the mothers and babies. Well, I know now to work with the legislators to try to improve this bill,
Okay.
to improve the health care. So that's my newest thing, is becoming an advocate
Okay.
for the mothers and babies. Be that voice.
Yes, and I think they have the right voice, because you will constantly, if you can't push the door, you're gonna kick it over. So they got the right voice out there. So I'm always happy to talk with you and learn what you're doing. Let me tell you how determined this woman is. The first interview that we were supposed to do, it was, I think it was like 15 minutes before we were supposed to. And I said, oh, well, she's probably going to, no, about 30 minutes. I said, oh, well, she's probably going to call and say that she can't make it, which is understandable, because I'm like looking at the weather, and all of a sudden it's like buckets of rain. It's pouring down, and the wind is blowing. You can hear it whistling.
Yes.
It's blowing up against the window, plate glass window. And it's like, and I'm like, oh my God, man, I'm going to have to call her. And I get this phone call, and she says, I'm about 10 minutes away. I'm like, what? I said, you 10 what? I'm like, I'm scared to go outside to walk over to the other side to get into the studio. It was that bad.
Oh, it was
and
bad.
I tell you, she came in, I mean, hair drenched. I think I was wet because I was coming from the other side. And she was so determined. She had all of her stuff, and she came in. She tried her hair, and she came, and we sat down and we did that interview.
That's right.
And that's why, no matter how many times she asked, I will always, always have a spot for her, because I have seen her just say, hey, that's all right, dry this hair off, we're going to do it. So that is a person who is determined. That is a person who can get things done.
Yes.
That is a person who's saying, we are not being taken captive, that we're going to bust out of this,
That's
that
right.
we're going to do it. And I think that the
That's
glass ceiling is going to be cracked, burst open,
That's
because of you being so determined that everyone learns how to help. It can be a coworker. It can be information given to a boss.
That's right.
Because if you really look at it, that will save you money.
That's right.
Rather than having this person out, not only for maternity leave, but they're out because they're not getting prenatal care.
That's right.
And that's a crazy
right.
thing. And I will go ahead and confess, I was a teen mom. My first baby, yes, I did go and get prenatal care. But with my second baby, didn't. And you know what happened? I had doctors that did not want to touch me because I didn't have like that 4 months of prenatal care. And only because at the time, this is crazier, I worked in the hospital. And the doctor was like, no, I'm, because he knew me, but I was just I didn't want to be pregnant,
Right.
So it was like, okay, well,
Right.
the first one was healthy. So,
Right.
But that was a crazy statement. So I'm just only sharing that because, you can't wait. When you find out that you're pregnant, start the prenatal care, because just thank God nothing was wrong with my child.
That's
but
right.
What if something had been wrong and I knew that it was 4 months
Right.
that it could have been caught,
That's right.
But we have to look at everything as no one wants to be in your business. We want healthy babies.
That's right.
And every baby is beautiful. Life, God gives life no matter what. But even if something is going on with your baby in the womb, getting that prenatal care can help you prepare.
That's right.
No matter what information. My granddaughter, she was pregnant with her with my first great grandbaby, and she at the time was on dialysis, so she had to have dialysis every single day, I think, except Sunday. And I was like, just going, oh my God, I just could not imagine. And then had a beautiful baby, and in January of 2025, she received a kidney. And her second pregnancy was a lot better.
That's a blessing.
It was, and I was thanking God because, what if?
Right.
we don't ever, when you're dealing with a baby,
Right.
we don't ever want to what if.
We don't want. That's
You
right.
know, and so that's why I'm glad that you are not going to the health department, going to the legislature.
Yes,
You know,
I know.
with this because this is great information that
Mhm.
people need to know,
Yes.
and we need to support and push. You know, I think sometimes we get on bandwagons and we're like, and then we run out of steam.
Mhm.
But this is affecting our future
That's
generations.
Right. That's right.
So I am all for what you are doing, all for supporting you. Give us your information again, your contact information.
My contact information is it's the Teenage Incentive Program. Number is 832-903-1272. That's for the teens. And if you are a high-risk mom and you need services, you could call 281-578-1205. And we are both on the website. The Teenage Incentive have a website, and New Life Perinatal has a website. And thank you. One last thing I wanted to say, when I go to the legislator, is this: if you send a nurse $100, $200 for a public health nurse, right, to go out, and you do that times 10 months, that's what, 2,400. But if you don't, and you have a sick baby. That's $1 million.
Wow.
No comparison.
None.
2,400 compared to $1 million baby. Every woman should have a nurse going out.
Yes.
Right.
Yes. And I really, for me, it makes sense.
Mm-hmm.
It makes sense to me,
right.
because you don't know what's going to, come up.
Right.
I think all parents need to know CPR.
Right.
When they're taking their baby home.
Mm-hmm.
I think everybody needs all of the information that they're being given now. So it just makes all the sense in the world to have a nurse, a medical professional that you can have working side by side with, to get the information that you need for that family, unit. So I think it's a great program that you have, and you've got my support.
Got yours. Yes. And one other statistic for our Black community, especially, a lot of us now, our young people are waiting to have babies.
Yes.
But they then have to maintain their health. You can't eat McDonald's every day, and you can't. And I had this one doctor say, she come to me, she's 200, almost 200, 300 pounds, and want to have a baby. Wow. So, back when we had babies young, our bodies hadn't stretched. But, we have to start thinking before we even consider getting pregnant.
Yes.
You want to get pregnant, stay healthy.
Yes.
Keep your health. It's good to get an education, and it's good to get a career, but keep your health as number one.
Yes.
We have to focus on our health.
But you never think about that, someone waiting to, to have a child, and they have, a weight problem or health problem, high blood pressure, diabetes. So that, because I do know that, excuse me, your hormones, your body changes. So if you do have something going on medically, you do definitely need to stay with a physician, and have that nurse that can go and walk you through each one of those steps. That really makes sense. I never even thought about that aspect of,
and that's why we used to only focus on 18 and under, but you gotta have that college student from 24, so they are getting pregnant. But even when you're in college, you still got to be thinking health. You got to be taking care of yourself. And then even once you start your career, you still got to take care, because one day if you get married, you want to have a baby. But you don't want to have a baby already with medical problems.
And that's true. So I see that you have a newsletter that is really, really beautiful, and I know it'll probably show backwards on here, but how do we get this newsletter?
It's on the website, or you could call us or whatever, but it is definitely on our website. And the newsletter is, we're highlighting one of the graduates from Eisenhower. He graduated in 2005. '05.
Oh, I
And
love
so we
that.
went back to the to the alumni and asked them to come back and give back, because
Ah,
that's the other
yes,
thing.
yes.
We have to give back to
That,
our schools.
yes.
You know, communities that thrive, schools that thrive,
Mhm.
it's because the alumni come back
Back.
and give. And so he's a class 20, it was their 20-year reunion. And
Oh,
so I did it for Black History. So this young man, I met him during the time we was working with their class.
yes.
And so he came aboard. He was very excited, and he's a businessman, graduated
Wow.
from, like I say, from Eisenhower. And so he helped with the end of the year award ceremony. He
Uh-huh.
bought lunches for the students for the
Oh my
award
goodness.
ceremony. And then we had an event for the teachers.
Yes.
He invested in the teachers.
Oh wow.
Yeah, and he came in and spoke to the students. Yes.
Oh my goodness.
And he's on our board. So
oh, that's great.
yeah, he really has given back as a from the, and that's what we're saying. Like I said, when you go to other districts, other places, and
yes.
they are having, it's not because the government is doing all. It's because the alumni is giving. It's because the people in the community, businesses are giving.
See, a lot of I think a lot of times people just think things are just going to happen, but it takes funds.
That's
it takes donations. It takes not only time, but it takes, you putting into, like you said, even if you can't be a mentor, if you can't attend a function, that you can be a financial support to them. And the information she's given out, on the website, because I think you do, have a donation button on there that you're able to donate. Nothing is too big, nothing is too small, because we are not only giving, but we're giving to the future. We're giving to the future of the children, to women. Well, we're just giving to the future of our Black community.
That's right.
We've got to give back something into the community. And I love that, the focus is on us, because right now, more than anything, we need unity. And we need to think about not ourselves all the time, but think about others. I started saying joy is Jesus first, others, and then yourself.
That's good.
And so that's real joy. Every day isn't, you're not going to be happy. Happy is fleeting, it'll come. But the true joy is seeing someone who didn't have, or someone who was struggling, and what you did, what you donated, what you donated in your time, help someone. To be able to make it a little further. So
that's right. That's good. That's good. And Teenage Incentive is a 501c3, where you're giving, it's a donation. But most of all, that's the heart of God.
Yes.
And that's a one of God's commission for us.
Yes.
Is to sow seeds. And when you sow, it's gonna come back.
Yes.
You may not see it, but your kids or family.
Yes.
And you want to be sowing good seeds.
My thing is, we never know when we may be in that seat.
That's right.
We never know. So, yet today it may be someone else, but tomorrow it could be us. It could be our child, our niece, our cousin, an uncle, or whoever, but we need to focus on what we can do and how we can do it better. And what Ms. Mattie is doing is that she's making the community better. And the group of people that has come together, they really get things done. It has just blossomed. Even when I was on the Zoom meeting, it was just, I was floored, because it was just expanding, and people want to be a part of what she's doing, because what she is doing. She is helping people to become better. And if what we're doing is not helping to make people better or advancing the kingdom, we're just doing stuff. But this, you see, it's in the pudding. It's in the pudding when those will come back. There were 10 lepers, but only one came back to say thank you. And Miss Mattie, I want to say thank you.
You're welcome.
You know,
Thank you
thank you
so
for
much.
the ones who are here now and those who are to come.
Mhm.
You know, to know that it's someone out there that's pushing for us, pushing for our Black children,
Mhm.
pushing for Black women, for Black men. You know, that are just pushing for us, because we would not be uh, sitting where we are
Mhm.
if there weren't our ancestors
That's right.
that were determined and
That's right.
pushing.
That's
You
right.
know, right now we don't have someone, sicking dogs on us or whatever,
Right.
but we still have those that say, oh no, they don't need that. So we have to support. We have to be a voice as well.
Mhm.
Push her on, encourage her. Prayer works no matter what's going on. Prayer works. And I am just so happy that I have the opportunity to sit here with you. And I hope that I will have the opportunity to sit with you again. And
Yes.
so that we can talk about those books
I
that she
know.
has.
I
She
know.
never, ever, ever, she wants to talk about everything else, but we're going to talk about those books.
That's right.
But I am just glad to have you here.
Thank you
And,
so much.
just-
And I will leave my last word is the initiative is still Infant Mortality Awareness Initiative, preserving our future,
yes.
preserving our, but saving our babies, all our babies, Black, white,
Yes.
Asian, because any number is a big number when they. So we want to save all our babies and mamas.
And we will. Hey, this is your girl Rhonda B on Forever Rhema Radio, and I am saying, hey, I want you to be a part of what will get us to the top. So I want to just tell you, hey, thank you for tuning in. It's been great. See you next week. This is your girl Rhonda B. Bye.
Bye. Bye.